Hospitals across the country, including here in Southwest Florida, are reporting a rise in COVID-19 patients. In today's Your Healthy Family, data shows most of those patients in the hospital are unvaccinated. But a doctor says other hospitalized patients right now are part of a group called the vaccinated vulnerable. Dr. Amy Telleron with the Cleveland Clinic treats people who are in the hospital with the virus. She says the vaccinated vulnerable can include the elderly and people who are immunocompromised.
The vaccinated vulnerable are those patients that have received the vaccine, but they have underlying conditions that make them more vulnerable to still getting an infection that may still be severe.
The vaccinated vulnerable can also include people with cancer, people who have had transplants, and anyone taking immunosuppressants or long-term steroids. It also includes people with lung disease like COPD and asthma, and heart disease, just to name a few. Some people with these chronic conditions may not have as strong of an immune response to vaccines, but the COVID-19 vaccine does help protect them against severe disease and death. While breakthrough infections or cases in people who are vaccinated do happen, vaccinated people are overall less likely to be infected, and if they are, their illness is typically more mild. Dr. Telleron says it's important to remember the vaccinated vulnerable are at an increased risk of infection from people who are unvaccinated.
We're lucky that we have vaccines available to us, so please do it to protect yourself. If you're not as interested in protecting yourself, please do it to protect those that you love, your parents, your grandparents, your children, those that have medical conditions, and those that cannot get vaccinated.
Now, she says getting vaccinated reduces the spread of COVID-19, and if you're eligible, go get your booster shot. I'm Lisa Greenberg with today's Your Healthy Family, and for more health stories, head to fox4now.com/yourhealthyfamily.